Welcome back. Well, we have the Orange County Public Health Services here with us today, and we have Dr. Michelle Chung, who is here to answer some very important questions about the coronavirus, COVID-19, whatever we need to call it. Let's talk a little bit about sort of where we're at here in Orange County, because we can turn to every station, CNN, Fox, whatever it is, and there's a lot of information out there, but we really just need to know sort of what we're dealing with right here in Orange County.
So here in Orange County, so far we have 6 cases of the COVID-19 infection. Overall, the risk is still considered low. We do not have community transmission documented here. But things are changing all the time. The situation's evolving very rapidly, and it is not unexpected that we will get community transmission here.
Okay. Well, so in talking about community transmission, explain to me what that really means.
So right now we have cases, most of them had traveled to an affected area, and that was their risk factor. And then we have one case that's a person-to-person transmission from one of those other cases, so a close contact, and that's totally not unexpected to have that.
Right.
So a community transmission case would be a case where we don't know the source. So they didn't have a risk factor, they didn't have contact with a known case, they didn't travel to an area that has sustained transmission. So then we're assuming that they got it somewhere in the community, and that's why we call it community transmission.
Okay, perfect. Now, with our residents, we have about 18,000 folks who are over the age of 55, and some of the concerns have been, do we need to be concerned being an elderly person? We've heard that there are some things that they can do to help prevent getting COVID-19. What are some things that you recommend?
So first, I do want to emphasize that data so far has shown that people who are older, as well as people with chronic medical conditions such as a compromised immune system, diabetes, heart disease, or lung disease, they are considered at increased risk for severe illness with this COVID-19.
Okay.
So it is recommended that all residents will take our everyday preventive precautions, which include washing their hands, using soap and water for at least 20 seconds. If they don't have soap and water, to use the alcohol-based hand sanitizer, avoiding contact with sick people, avoiding touching their mouth, their nose, and their eyes, because that's a way you can contaminate yourself with the virus as well. And then also, if they're sick, that they should stay home, avoid contact with other people. They should also clean and disinfect routinely using normal everyday household disinfectants.
Right.
So those are the things that everyone should be doing. But for the people at increased risk, which includes the elderly, it's recommended that they avoid non-essential plane travel. In addition, that they avoid cruise travel, and they avoid large gatherings.
Right.
Just today, this morning, there's new guidance from the State Health Department, which is on a more general level that's going to affect us all. The recommendations are evolving, so we just heard of them this morning, and I'm sure there's more information that's going to be coming out. But right now, the recommendations are that all large public gatherings over 250 people are canceled.
Wow.
And then for people at high risk, which again includes the seniors, gatherings over 10 people are canceled.
Wow, okay.
So if there are going to be gatherings that can maintain 6 feet between people, then they may be allowed to continue, but those are the general recommendations. And this just affects those public gatherings that are non-essential. They are still holding school.
Okay.
This does not apply to school or work or any essential services.
Okay. Well, it's tough because when you say 6 feet, but then you say it could be on surfaces too, which comes in the hand washing and the Purell and that kind of thing. But we should have been doing this all along, regardless of what type of diseases are out there, correct?
Yes, those are our general recommendations for, especially in flu season, that we are doing those same precautions. But now that's bringing it more to light, trying to emphasize with people that this really is important. And the thing to note, the surfaces, those common disinfectants do kill the virus. So if people are, sanitizing, disinfecting the surfaces regularly, that should be a helpful measure. The other thing for people who are at increased risk is to start being more prepared themselves in terms of making sure they have their medications at home in case they can't go out, or making sure they have some household items, food, groceries, having a plan of who might take care of them. And then if they do have children, also to have a plan in case at some point we do need to do something with the schools and close the schools as well.
Now, while this is a very serious situation, and as you said, it is evolving, and maintaining medical supplies. So as we've seen, people have just gone out and bought lots of different kinds of things that possibly don't relate. Other than medication, I mean, or I guess I should ask, how long should they think about having supplies for? 2 weeks?
That's the general recommendation, about 2 weeks right now. I'm hoping that they would have access to those supplies after that time period, yes.
Okay, all right, great. Now, what would happen if we did find cases here locally, not necessarily in our community of Laguna Woods Village, but just externally and here in Orange County? What are some things that would happen that we should be prepared for?
So we do have cases in Orange County. So with the health department investigates every case. The case is asked to be put into isolation so they're not around other people. And then their close contacts are also asked to stay home. So they're called quarantine.
Yes.
They're not sick yet, but because they might potentially become sick and transmit, they're asked to stay home as well.
Okay.
So that would be something that would happen here as well. The health department right now is following up on every case, and if there was an exposure here at Laguna Woods, they would inform the people who were exposed.
Okay.
As time goes on, with more cases though, if we do have sustained community transmission, we may not be following up on any case, on every case. So that is also going to change as time goes on, because of course if there's hundreds and hundreds of cases, it's we would not be able to do that.
Okay, all right, great. And for all of us to be able to find out up-to-date information, what do you recommend are some of the sites that we should go to?
So the Orange County Healthcare Agency does keep an up-to-date website with our numbers and also resources, and that's ochealthinfo.com.
Okay.
In addition, the Centers for Disease Control and Prevention, which is cdc.gov, they have very up-to-date recommendations, including for the seniors, on that website too.
Okay, perfect. And then I also wanted to mention that we will have our own website, which is lagunawoodsvillage.com, and we've started to update everybody now. With right in the middle of the website, you will see it says coronavirus update, and you'll be able to click on that button, and it will bring you to some more information and up to date as much as we can here. So hopefully everybody will be able to stay informed that way. Is there anything else that you think we should know?
Just basically that it's up to everyone to be prepared themselves, and that's important that they're starting to plan for what this might happen if it happened to their family and themselves as well. Yeah.
Right. Okay. Well, thank you so much for the information. I know you're really busy, so we appreciate you taking the time.
Thank you.
All right. And remember that here at TV6, it includes all of our media and communications team, and we will keep you up to date as much as we can. As I mentioned, with the website, we will have the coronavirus update button right in the middle there, right under where new adventures begin. And then if you click on that, you will see that there will be notifications there, and we will try to bring you as much information as we can there, as well as TV6, and that includes any late information that we have, including breaking news. We'll be right back after this.